Shining light on night blindness, causes, symptoms, and treatments. Imagine stepping outside after dusk, only to feel as though a veil has dropped over your vision. Street lights blur, shadows seem darker, and your eyes struggle to adjust. For people living with night blindness, also known as nyctalopia, this is more than just a temporary inconvenience. It's a real visual impairment that can impact daily functioning, limit independence, and sometimes signal deeper health concerns. This article shines a light on night blindness, exploring what causes it, how it affects vision, and the modern options for diagnosis and treatment. What is night blindness? Night blindness isn't a condition in itself. It's a symptom of an underlying problem that affects your ability to see well in low-light environments. People with night blindness may struggle to see in dimly lit rooms, outdoors after sunset, or when driving at night. It can also take much longer for their eyes to adjust from bright to dark settings. The medical term for night blindness is nyctalopia, and it can range from mild to severe depending on the cause. Symptoms of night blindness. Poor vision in dim or dark settings. Difficulty adjusting between bright and dark environments. Glare and halos from headlights or streetlights at night. A sensation of tunnel vision or decreased peripheral vision in low light. Trouble recognizing faces or obstacles in poorly lit areas. If these symptoms are interfering with your quality of life, it's important to see an eye care professional for an evaluation. What causes night blindness? Night blindness can stem from a number of eye conditions and systemic health issues. Some of the most common include: 1. Vitamin A deficiency. Vitamin A is essential for the function of rod cells in the retina, which are responsible for seeing in low light. Deficiency, although rare in developed countries, can result in severe night blindness and even permanent vision loss if untreated. Causes of deficiency may include malnutrition, gastrointestinal disorders, e.g., Crohn's, celiac disease, liver disease, bariatric surgery. 2. Retinitis pigmentosa, RP. RP is a genetic, progressive retinal disease that causes gradual degeneration of photoreceptor cells, particularly rod cells. One of the earliest symptoms is night blindness, often followed by peripheral vision loss. 3. Cataracts. Clouding of the eye's lens due to cataracts can scatter light and impair night vision. Cataracts are common with aging and can make nighttime glare from headlights unbearable. 4. Glaucoma and glaucoma medications. Glaucoma affects the optic nerve and can cause peripheral vision loss. Certain glaucoma medications, like miotic eye drops, can reduce the amount of light entering the eye and worsen night vision. 5. Diabetic retinopathy. In people with diabetes, damage to blood vessels in the retina can impair low-light vision. 6. Congenital conditions. Some people are born with conditions that affect their ability to see in dim light, such as congenital stationary night blindness, CSNB, a rare, non-progressive genetic disorder. 7. Myopia, nearsightedness. Severe myopia can make night vision more difficult, especially in uncorrected cases. Glare, halos, and poor contrast in dim light are common complaints. How is night blindness diagnosed? Diagnosis begins with a comprehensive eye exam, during which an ophthalmologist or optometrist may measure visual acuity and refractive error, examine the retina and optic nerve using fundoscopy, use imaging, like October or retinal photography, to assess retinal health, conduct dark adaptation testing to see how quickly your eyes adjust from light to dark. For suspected inherited conditions like RP or CSNB, genetic testing may be recommended. Blood tests may also be ordered to check for vitamin A levels or assess for systemic disease. Can night blindness be treated? The treatment for night blindness depends on the underlying cause. 1. Vitamin A deficiency. Supplementation with vitamin A can restore night vision if the deficiency is caught early. This is a highly treatable cause, especially in regions where vitamin A supplementation programs are in place. 2. Cataracts. Cataract surgery, replacing the clouded lens with a clear intraocular lens, IOL, can dramatically improve night vision. 3. Retinitis pigmentosa. While there's currently no cure for RP, certain approaches may help slow progression. Vitamin A palmitate, under medical supervision. Use of low vision aids and assistive technology. Gene therapy, an emerging option for specific mutations. 4. Glaucoma. Treating glaucoma early can help preserve existing vision, although it won't restore lost night vision. Medications or surgery may be needed to lower eye pressure. 5. Addressing other conditions. Blood sugar control in diabetics can prevent further retinal damage. Glasses or contact lenses for myopia may improve night vision clarity. Specialized lenses, anti-reflective coatings or yellow-tinted lenses, may reduce glare. Living with night blindness. While treatment may not always be possible, especially in genetic or progressive cases, there are lifestyle strategies that can help. Avoid night driving if vision is severely affected. Use brighter lighting at home, especially in stairwells and hallways. Install motion sensor lights for safety at night. Carry a flashlight or use a smartphone light in dark areas. Use assistive devices, such as magnifiers or night vision apps. Working with a low vision specialist can also provide customized tools and strategies for navigating low-light environments more safely. Prevention. Can you avoid night blindness? Some causes, like genetics, can't be prevented. However, you can reduce your risk with these habits. Eat a diet rich in vitamin A, including leafy greens, carrots, sweet potatoes, and liver. Wear UV protective sunglasses to prevent retinal damage. Manage chronic conditions like diabetes and high blood pressure. Get regular eye exams, especially if you're over 40 or have a family history of eye disease. Conclusion. Lighting the way forward. Night blindness isn't just a nuisance, it's a condition that can affect safety, mobility, and independence. But understanding the cause behind the symptom opens the door to effective treatment and management. Whether it's as simple as a dietary change or as complex as genetic therapy, help is available. If you or someone you know is struggling with poor vision at night, don't wait. See an eye care professional and take the first step toward clearer sight, even after the sun goes down.